You wake up more tired than when you went to bed. You feel a little dizzy when you stand. Your ankles are puffy by evening. There's a cough that won't quite go away. Your memory feels a half step slower than it used to. And every time you mention any of it, you hear the same three words. It's just your age. I want to challenge those three words today, gently but firmly, because here is something most people over 65 have never been told. Some of the symptoms we've all been taught to file under getting old are not aging at all. They can be side effects, quiet, easily missed side effects of common medications, hiding in plain sight, dismissed by everyone because they look exactly like ordinary aging. And when a symptom gets mislabeled as age, something troubling happens. Everyone stops looking for the real cause. Nobody investigates. You just get told to accept it. Today I'm going to walk you through 7 symptoms that are far too often blamed on aging when they may be something else entirely, something worth a real conversation with your doctor. And I want you to stay with me all the way to the final one, because it's the symptom that frightens people the most, and it's the one most likely to be quietly misunderstood. But before we begin, one thing I need to make absolutely clear. Nothing here is a reason to stop or change any medication on your own. This is about learning what to notice and what to ask so that you and your doctor together can get to the truth. Let me ask you honestly, how many times have you felt something was off, brought it up, and been sent home with a shrug and the reassurance that it's normal for your age? And how many times did that answer sit uneasily with you? Because deep down, it didn't quite feel like just age. If you've been there, you're not imagining things, and you're not being difficult. You may be picking up on something real. The trouble is that aging and medication side effects can look almost identical from the outside. Same fatigue, same dizziness, same fog. The only way to tell them apart is to actually look. And most of the time, nobody looks. Because the moment the word age gets attached, the investigation ends. That's the pattern we're going to break today. So here's my promise. 7 symptoms, one at a time, each one something you can bring into the light and ask a better question about. Pay special attention when we get to number 6 because it's a symptom that can be dangerous, specifically because it often comes with no warning at all. If this is the kind of information you wish someone had told your family years ago, take a second right now and subscribe, because this is exactly the kind of conversation this channel exists for. Now let's begin with the most common one of all. But first, let me give you one idea that makes all 7 of these click into place, because without it, they're just a list, and with it, they become a lens you'll use for the rest of your life. Here it is. As we age, our bodies become less forgiving of medications, not because anything is wrong, but simply because of how bodies change over time. In your 50s, if a medicine pushed something slightly too far, your body had the reserves to quietly absorb it, and you never felt a thing. Past 65, those reserves shrink. Your kidneys and liver clear medications more slowly, so the same dose can build up to a stronger effect. Your circulation is a beat slower to respond. Your balance system is less quick to catch you. So the very same pill, at the very same dose that served you beautifully for years, can start producing real, noticeable symptoms, not because it stopped being a good medicine, but because the body taking it has changed. This is the reason it's worked fine for years is not proof that it's still the perfect fit today. And it's the reason so many of these symptoms get waved away as aging. They appear right around the age when the body's forgiveness runs thin, so of course they look like age. But looking like age and being age are 2 very different things. Keep that idea with you as we go through all 7. The first symptom is relentless fatigue, the kind of tiredness that sleep doesn't fix. This is the one people surrender to the fastest, because everyone knows older folks are supposed to be tired. But there's tired, and then there's the specific, heavy exhaustion of feeling wiped out by early afternoon, unable to focus, needing to sit down, watching your energy fall off a cliff a few hours after you take your morning pills. Here's what many people never consider. Some blood pressure medications, especially at a dose that's a touch too strong for an aging body, can leave you feeling drained precisely because they're lowering your pressure a bit more than your body would prefer. When there's slightly less pressure driving blood to your brain and muscles, fatigue can follow. Now, this does not mean your medication is wrong. and it absolutely does not mean you should skip it. It means that if a bone-deep tiredness showed up or worsened around the time a medication was started or increased, that timing is worth mentioning to your doctor. Timing is the clue. Write down when the fatigue is worst and when you take your medications, and bring that pattern in. That simple observation can open a conversation that a vague, "I'm just so tired," never will. I think of a woman I'll call Eleanor, who had quietly rearranged her entire life around her afternoon exhaustion. She'd stopped meeting her friends for lunch because she knew she'd be fading by the time the food arrived. She napped every day, not because she wanted to, but because she felt she had no choice. She was convinced this was simply the shape of her life now. But when she finally mentioned to a new doctor that the tiredness had really taken hold around the time her medication dose was raised, that one detail, that timing, changed the entire direction of the conversation. Nobody had ever connected the two because nobody had ever asked. Her story is a perfect example of why the when matters as much as the what. The second symptom is dizziness or lightheadedness when you stand up. This one gets brushed off constantly. Stood up too fast, didn't drink enough water, just old age. And sometimes that's all it is. But here's what deserves a closer look. If your blood pressure is being lowered firmly, your vessels may not be able to tighten quickly enough when you rise from sitting or lying down, and for a few seconds your brain gets too little blood. That's the wave of dizziness, the graying vision, the reach for the wall. In an older adult, this isn't just unpleasant, it's one of the biggest hidden causes of falls, and a fall can change everything. The mechanism has a name, but you don't need to memorize it. What you need to know is this: dizziness on standing is not something to simply live with, and it is very checkable. Ask your doctor to measure your blood pressure while you're standing, not only while you're seated, because the seated reading can look perfect, while the standing reality is putting you at risk. And in the meantime, protect yourself with one simple habit. Rise in stages. Sit up, pause, then stand slowly. Give your body the extra second it now needs to catch up. If this is already ringing true for you, tap the like button. It helps this reach other people quietly dealing with the very same thing. The third symptom is swollen ankles and feet. So many people accept this as an inevitable part of getting older that they never even mention it. They just buy bigger shoes and prop their feet up at night. But puffy, swollen ankles can be a recognized side effect of one common family of blood pressure medications, and it tends to become more noticeable with age and with higher doses. Here's the simple mechanism. These medicines can widen your arteries more than your veins, which lets a little fluid seep out into the tissue of your lower legs. It's often written off as harmless and cosmetic, but in an older body, it can quietly matter, because swelling can make you less mobile, and less mobility can start a slow slide in the wrong direction. So don't just accept the wider shoes. Mention the swelling. Ask whether a medication review makes sense, because alternatives and adjustments exist, and this is exactly the kind of thing your doctor can help sort out. A symptom that's changing the shoes you can wear and how comfortably you move deserves more than a shrug. And here's the piece people miss. Swelling isn't always just about comfort. When it becomes significant, it can occasionally be masking something happening underneath, a circulation issue that's developing quietly, while everyone assumes the puffiness is just the medication, nothing to worry about. That's precisely why it's worth having looked at properly, rather than simply accepted. Not to alarm you, most ankle swelling really is the straightforward side effect it appears to be. But because the only way to know for sure is to have someone actually check, instead of waving it away unseen. The fourth symptom is a persistent dry cough that won't quit. This one is so easily misattributed it's almost tragic. People chase it for months. Allergist, lung specialist, chest x-rays, sleepless nights of worry, when the answer may have been sitting in their pill organizer the whole time. One common family of blood pressure medication is well known to cause a dry, tickling, persistent cough in a meaningful share of people, roughly around 1 in 10, because of a natural substance that can build up in the airways when the drug is working. The cough is stubborn, it's dry, and no cough syrup touches it. And here's the genuinely good news. It's one of the most solvable situations in all of medicine. If a new unexplained cough appeared after you started a blood pressure medication, That timing is a gift of information. Bring it to your doctor. For most people, a thoughtful switch to a different class, made together with your physician, clears it up entirely. But that switch is always a decision you make with your doctor, never alone, because stopping a blood pressure medicine on your own carries real risk. The cough is fixable. The way you fix it is by asking, not by quitting. And I want to name the hidden cost of this one because it's bigger than it looks. A relentless cough doesn't just annoy you, it wears you down. It interrupts your sleep night after night, which feeds right back into that fatigue and fog we already talked about. It embarrasses people in church, at the movies, at dinner with friends, until they start staying home. It can even cause dizziness during a hard coughing spell, which raises the risk of a stumble. So a symptom that gets written off as a minor tickle can quietly unravel someone's sleep, their social life, and their steadiness all at once, which is exactly why solving it, with your doctor's help, can give back so much more than a quiet throat. The fifth symptom is brain fog, that frustrating sense that your thinking is a little slower, a little cloudier than it used to be. This is perhaps the most heartbreaking one to write off as age, because so many people quietly grieve it, convinced their sharpness is simply gone for good. And sometimes, some change is a normal part of aging, but not always, and not entirely. When blood pressure is lowered more than an aging brain would prefer, that brain may be getting slightly less blood flow than it likes, and mental fogginess can follow. It can be that specific and that mechanical. The reason this matters so much is that people accept fog as permanent when, in some cases, it's connected to something adjustable. Once again, this is not a reason to touch your medication on your own. It's a reason to mention it. My thinking has felt foggier lately, and I want to understand whether anything I'm taking could be part of it. That is a completely fair, completely reasonable thing to explore with the person who manages your care. Don't quietly mourn something that might be worth investigating. And let me say why this one cuts so deep. Of all the symptoms on this list, brain fog is the one people are most ashamed to admit. Fatigue you can explain away. Swollen ankles you can hide in bigger shoes. But feeling like your mind is slipping? That scares people to their core. And so many suffer it in silence, terrified of what it means, too frightened to even say it out loud. They stop doing crosswords because they're afraid of struggling. They avoid conversations where they might lose a word. They shrink their world to hide it. And the cruel irony is that in some cases, the very thing they're grieving as permanent may be connected to something adjustable, something a simple conversation could begin to untangle. So if your thinking has felt cloudy, please don't carry that fear alone and in silence. Naming it to your doctor is not admitting defeat. It's the first brave step toward possibly getting some of that clarity back. And even if part of it is ordinary aging, you deserve to know that, rather than to fear the worst in silence. Now, before the last two, let me pause and say something important because this whole list can start to feel frightening, and I don't want that. Every single one of these medications helps enormous numbers of people live longer, healthier lives. The point of today is not to make you fear your medicine, it's the opposite. The point is to make sure your medicine is working for the whole you, not just for the number on a chart. You are not powerless here. You are the person who lives in your body all day, every day, and your observations are genuinely valuable medical information. If this is helping you see that, this is the perfect moment to hit like and subscribe, because we're building a community of people who refuse to hand their health over to a shrug and 3 little words. Now, 2 more. The 6th symptom is one that's dangerous precisely because it often has no symptom at all, and that's exactly why it belongs on this list. I'm talking about a quietly rising level of potassium in the blood. 2 common families of blood pressure medication can, over time, allow potassium to climb because they lower a hormone that normally helps your kidneys clear it out. Add to that the natural slowing of kidney function with age, plus all the healthy high-potassium foods many seniors eat, bananas, spinach, potatoes, beans, plus the salt substitutes and supplements people use without a second thought, and it can quietly accumulate. Here's why it's frightening. Elevated potassium usually causes no obvious feeling at all, right up until it can affect the heart's rhythm. You can't feel your way to safety on this one, which is exactly why it must be watched rather than felt. So this symptom is really the absence of one, and the action is simple. If you're on one of these medicines, your potassium and kidney function should be checked on a regular basis. At your next visit, ask plainly, "When was my potassium last checked?" And please don't dramatically overhaul your diet on your own based on this. A sudden change can cause its own problems. This is a monitoring conversation, and it's one of the most important ones on this entire list. And let me add one honest, practical note here, because people hear high potassium and immediately want to throw out all their bananas and spinach in a panic. Please don't. Those are wonderful, healthy foods, and for most people, they're not the problem. The issue is the whole picture combined. The medication, plus aging kidneys, plus supplements or salt substitutes, plus diet, all stacked together, and only your doctor can weigh that full picture for you. The answer is not to fear your vegetables. The answer is simply to make sure the number is being watched. Quick question for you right here, because I'm genuinely curious. Of the symptoms we've covered so far, how many were you or someone you love told was just aging? Drop the number in the comments. It helps me understand how widespread this really is, and honestly, it helps you too, because putting it into words is the first step toward doing something about it. The seventh symptom, the one that frightens people most, is unexplained falls or near falls, and that terrifying feeling of nearly going down. People blame this on age faster than almost anything. "I'm just unsteady now, that's how it goes." But a fall is rarely random. Very often it's the end of a chain that started somewhere upstream, and sometimes that somewhere is a blood pressure that's being pushed too low for an older body. Here's the cascade I need you to understand, because it's the reason all of this matters so deeply. Blood pressure lowered firmly. You stand. Your vessels can't compensate fast enough. Your brain briefly starves for blood. You feel dizzy, your vision dims, you reach, you miss, and you fall. And a fall, at our age, can begin a long and difficult story. A fracture, a surgery, a hospital stay, a loss of independence that never fully comes back. One number on a chart that everyone thought was good news can quietly set that in motion. This is why the lowest blood pressure isn't automatically the safest. So if you or someone you love has been falling or feeling unsteady or catching themselves, please don't file it under just getting old. Bring it to the doctor as the serious clue it is. Ask about standing blood pressure. Ask whether the target is still right for this age and this body. Falls are not an inevitable part of aging to be endured in silence. They are very often a signal to be investigated. And I want you to understand what's truly at stake, because it's more than a bruise. For an older adult, independence often hangs on steadiness. The ability to stay in your own home, to drive, to garden, to pick up a grandchild, to live life on your own terms. So much of it rests on not falling. A single serious fall can be the moment everything changes, the line between before and after. That's why I refuse to let this one be shrugged off. If unsteadiness is creeping in, it is worth every ounce of effort to find out why. Because what's being protected isn't just a bone, it's a whole way of living. And if the cause turns out to be a blood pressure that's simply being pushed a little too low, that is often something you and your doctor can address together, which means those falls were never inevitable at all. So let's pull all 7 together, because I don't want a single one to slip away. Relentless fatigue, dizziness on standing, swollen ankles, a stubborn dry cough, brain fog, a silent rise in potassium, and unexplained falls or unsteadiness. Notice the thread running through every one of them. Each is routinely blamed on aging, and each may, in some people, be something else, something worth a real look. And notice something just as important. Not one of these is a reason to touch your medication on your own. Every single one is a reason to observe, to write it down, and to ask a better question at your next appointment. Here's how you actually use this, because knowledge that just sits there helps no one. Don't walk away anxious. Walk away prepared. Between now and your next visit, keep a simple little note. Jot down what you're feeling and when, especially in relation to when you take your medications. Timing is the single most useful clue you can hand your doctor. Then bring that note in and open with something warm and simple. "I've been noticing a few things, and I've written them down. Can we go through them together?" That one sentence turns a rushed visit into a real conversation. Bring a family member if it helps. And if you don't get through everything, it's perfectly reasonable to continue at a follow-up. Let me leave you with the honest truth. because you deserve it and not fear. Aging is real, and some changes truly do come with the years. I'm not here to pretend otherwise. But it's just your age should be the conclusion after someone has actually looked, not the excuse for never looking at all. You have every right to ask for that look. And you get there not by changing anything on your own. Please hear that one final time. Do not stop, reduce, or alter any medication based on this video, but by becoming an informed, observant partner in your own care. Everything here is general education, not medical advice, and it can't know your specific situation the way your own doctor can. What it can do is help you notice what's worth noticing and ask what's worth asking. If this opened your eyes today, share it with someone you love who's been told one too many times that it's just their age. Subscribe so you don't miss what's next. And tell me down in the comments, which of these 7 surprised you the most? And where in the world are you watching from? I read every single one. Take care of yourself, bring your notes to your doctor, and I'll see you in the next one.